I want to ask you something that might make you uneasy. If a physician sat down with you tomorrow and said, based on what I see in your biology, I can predict with reasonable certainty which system in your body is most vulnerable to breaking down after age 60. Would you want to hear it? Most people say absolutely, and then they walk out and never think about it again. I'm Dr. Laura Berman, and I've been practicing functional and preventive cardiology for over 18 years. And there's one piece of biological data that's been sitting in your medical chart since the moment you were born, something so basic we overlook it entirely, and yet it holds extraordinary predictive power over how your arteries will age, how resilient your brain will remain under strain, how your digestive system will respond to microbial threats, and yes, what's most statistically likely to end your life if you fail to act on the early signals. I'm talking about your ABO blood group, not the pseudoscience you see in trendy diet books or personality quizzes on Instagram. I'm talking about the evidence from decades-long epidemiological cohort studies tracking millions of people across continents, studies that show unequivocally that the antigen markers on your red blood cells leave detectable patterns on your risk for myocardial infarction, cerebral decline, gastric malignancy, autoimmune dysregulation, and thrombotic events. Today, I'm breaking down all four groups, O, A, B, and AB, and for each one, I'm going to share something your family doctor probably never had the time to explain. Not because it's being hidden from you, but because a 15-minute office visit doesn't leave room for this kind of conversation. I'm giving you that time right now. But before we dive in, do me a favor. Drop a comment below with your blood group, O, A, B, or AB. I'm covering each one, and knowing yours will make the next 15 minutes far more personal for you. And stay until the end, because there's a biological modifier, a small plus or minus symbol next to your blood group letter that changes everything. Most people have never been told what it means. Let's begin with Group O. I want to completely reframe this for you. Group O isn't just widespread, it's primal. Nearly half of humanity carries it, and for the vast majority of our evolutionary past, that was a profound survival edge. Group O likely appeared in early human lineages, navigating harsh, resource-scarce landscapes where physical resilience, rapid immune reactivity to parasites, and the capacity to metabolize animal flesh under extreme duress separated survivors from casualties. Here's what that ancient genetic blueprint looks like when it's housed inside a 68-year-old modern body. On the vascular side, Group O individuals naturally produce lower concentrations of a clotting protein called von Willebrand factor. Reduced clotting factor means blood moves more freely, platelets aggregate less aggressively, and arteries are statistically less vulnerable to the obstructions that trigger heart attacks and ischemic strokes. Large-scale meta-analyses confirm it. Group O individuals demonstrate a measurably reduced risk of coronary artery disease compared to A, B, and AB types collectively. That's real protection. But here's the trap, and I encounter it constantly in my practice. A Group O patient walks in at 62, blood pressure's solid, cholesterol panel looks reasonable, no cardiac events in the family, and because they feel vascularly invincible, they begin ignoring the systems that are silently deteriorating underneath. They brush off chronic exhaustion. They rationalize persistent indigestion. They power through unexplained joint discomfort. Because Group O's most dangerous age-related vulnerabilities don't originate from the cardiovascular system. They originate from the gastrointestinal tract. The mucosal surface of a Group O stomach displays receptor proteins that Helicobacter pylori, a gram-negative bacterium, attaches to with remarkable ease. H. pylori doesn't cause acute, dramatic symptoms in most individuals. It colonizes quietly, systematically erodes the gastric mucosa over years, sometimes decades, and triggers a progression from chronic inflammation to peptic ulceration to, in a statistically significant percentage of cases, gastric adenocarcinoma. And gastric cancer detected in advanced stages is one of the most challenging malignancies to treat effectively. Group O individuals also demonstrate higher rates of ulcer-related complications necessitating surgical management compared to other blood groups. This isn't speculative, it's documented across multiple population-level studies. So if you're Group O and you're past 55 and you've never been screened for H. pylori, That's the single most critical preventive measure you can take this year. It's a straightforward stool antigen test or urea breath test, affordable, non-invasive, and for Group O individuals, it's not routine screening. It's precision prevention tailored to your biological vulnerability. Here's your longevity roadmap if you're Group O. Your gastrointestinal system is your weakest link. Defend it intentionally. That means minimizing chronic reliance on non-steroidal anti-inflammatory drugs like ibuprofen or naproxen unless medically essential. These medications strip gastric lining in everyone, but in Group O individuals, they're acting on tissue that's already at heightened biological risk. Integrate fermented foods into your weekly diet. Kefir, sauerkraut, kimchi, naturally fermented vegetables. For Group O, these aren't wellness trends. They're functional interventions for cultivating a gastric microenvironment that resists pathogenic bacterial overgrowth. And physically, your physiology was designed for motion. Group O blood correlates with elevated baseline levels of catecholamines, dopamine, and norepinephrine, meaning your nervous system operates at a higher baseline intensity than other blood groups. When that energy lacks an outlet, it transforms into restlessness, fragmented sleep, and ultimately, cortisol dysregulation. 30 minutes of daily walking combined with 2 weekly resistance training sessions will do more for your metabolic longevity than any supplement protocol on the market. Group O, you inherited vascular resilience. Your digestive tract is your obligation. Don't let the former create complacency about the latter. Before I continue, tell me your name and where you're watching from. I read every single comment, and I genuinely want to know who I'm reaching today. Now let's discuss Group A. And I need your complete focus here because this is the blood group where the gap between common knowledge and clinical reality is the most dramatic. Group A appeared as human populations shifted from nomadic hunter-gatherer lifestyles to settled agricultural communities, higher population densities, more intricate social frameworks, broader exposure to infectious disease. The immune architecture evolved accordingly. Group A individuals generate robust, aggressive immune responses, especially against viral pathogens. In your 20s and 30s, that's genuinely protective. But here's the paradox. What shields you early in life starts working against you by your 60s. Group A blood exhibits higher coagulation activity. Your platelets are stickier. Your clotting cascade is more reactive. A landmark cohort study from Harvard following over 800,000 adults across 2 decades revealed that Group A individuals carry a 5% elevated risk of coronary heart disease compared to Group O. That seems modest on the surface, but here's why it's clinically critical. When you overlay chronically elevated cortisol, your body's primary stress hormone, onto that already sticky platelet activity, the compounding effect over decades is what converts a modest statistical risk into an actual cardiac event. And here's the dimension most conversations entirely miss. Group A individuals sustain the highest baseline cortisol concentrations of any blood group. Cortisol in brief episodes is beneficial. It sharpens mental clarity, mobilizes glucose, prepares your body for challenge. But when cortisol remains chronically elevated, day in and day out, week after week, it does something very specific to your vascular architecture. It inflames and rigidifies the endothelium, the delicate inner lining of your blood vessels. And here's the mechanism every Group A individual should deeply understand. When your endothelium is inflamed and less pliable, it becomes a surface that sticky platelets preferentially cling to. The elevated clotting activity of Group A blood and the chronic cortisol-driven endothelial damage of Group A physiology aren't 2 independent risk factors. They're a reinforcing loop. Each intensifies the other. What this means practically is that for Group A individuals, stress management isn't a lifestyle add-on. It's direct cardiovascular intervention. It belongs in the exact same conversation as antihypertensive therapy and lipid management, because physiologically, it's targeting the identical pathway. If you're Group A and past 55, blood pressure assessments every 6 months instead of once a year aren't excessive. They're appropriate surveillance for your specific biology. Request that your physician include homocysteine in your next laboratory panel. Homocysteine is an amino acid that, when chronically elevated, directly injures arterial walls. Group A individuals tend toward higher homocysteine levels, and the solution is remarkably straightforward. Sufficient intake of folate, B12, and B6, readily available in dark leafy greens, eggs, legumes, and lean animal proteins. Not costly, not complex, but tailored specifically to you, and establish a daily cortisol reset ritual, not a quarterly wellness retreat, not an occasional guided meditation session, something you execute every single morning before the world places demands on you. Diaphragmatic breathing, 4 seconds in, 6 seconds out, practiced for 10 minutes, demonstrates measurable effects on cortisol regulation in published clinical trials. Consistency matters infinitely more than duration. 5 minutes every morning vastly outperforms an hour on Sunday. Group A, powerful immune architecture. Elevated cardiovascular risk amplified by a stress hormone your blood group keeps chronically high. Managing that hormone is the most critical health decision you'll make this decade. If you're still with me and finding this valuable, just type A in the comments. It lets me know you're here and getting something meaningful out of this. Let's discuss Group B. The blood group conventional medicine understands the least and mainstream wellness culture mishandles the most. Group B appeared among nomadic populations migrating across the steppes of Central Asia and the high plateaus of the Himalayas. These were people perpetually adapting to shifting terrains, novel food sources, extreme climatic variations, unfamiliar infectious challenges. The immune system that emerged is genuinely extraordinary in its metabolic versatility. Group B individuals can efficiently metabolize a diverse range of proteins, fats, and carbohydrates without the inflammatory friction other blood groups sometimes generate in response to dietary variation. That versatility is authentic. In the context of human evolution, it was a critical survival asset. But here's the clinical challenge most Group B individuals past 55 are navigating without awareness. Group B possesses a distinctive immune signaling profile that we don't yet fully comprehend mechanistically. What the research consistently demonstrates is that Group B individuals appear to possess a broadly adaptive immune response, one that processes a wide spectrum of dietary and environmental inputs differently than other blood groups. Studies validate that Group B individuals harbor measurably distinct gut microbiome compositions, and that specific inflammatory dietary triggers, refined seed oils, ultra-processed packaged foods, high fructose corn syrup, appear to provoke stronger systemic inflammatory cascades in Group B compared to other blood groups. The autoimmune terrain across blood types remains under active investigation, and the findings are nuanced. What is unambiguous is that maintaining your inflammatory baseline low through diet, movement, and routine C-reactive protein monitoring represents the most evidence-supported longevity protocol for Group B. If you're Group B and you've been addressing vague symptoms with lifestyle modifications alone, dismissing them as natural aging, it warrants a direct conversation with your physician about autoimmune screening. Early detection of autoimmune conditions fundamentally transforms the entire treatment trajectory. There's a second challenge specific to modern industrial food environments for Group B individuals. The contemporary Western diet is essentially a calibration crisis for your immune system. Refined seed oils, ultra-processed manufactured foods, high fructose corn syrup. These aren't merely nutritionally bankrupt. For Group B individuals, research indicates these inputs function as particularly powerful triggers of systemic low-grade inflammation, the variety that simmers beneath awareness for years and progressively distorts immune accuracy. Your C-reactive protein concentration, a standard inflammatory biomarker accessible on routine blood work, should be monitored minimally once annually. A persistent CRP reading exceeding 1 milligram per liter without an identifiable acute infection represents a warning signal. It indicates your immune system is operating in a chronically activated state, and you need to identify the trigger before it identifies you. For physical activity, Group B physiology responds optimally to sustained moderate intensity movement rather than repeated high-intensity intervals. Cycling, swimming, hiking, consistent walking. These safeguard your inflammatory baseline far more effectively than interval training protocols that generate acute inflammatory surges during recovery. Group B, the most metabolically versatile blood group on the planet. Maintain your immune system precisely calibrated, and it's among your greatest strengths. Allow it to run unchecked, and it becomes among your most dangerous liabilities. Before I proceed, if this is helping you connect the dots about how your body might be reacting to what you consume and how you move, do me a small favor and hit the like button. It helps this kind of research-grounded, actionable information reach more people who are quietly managing exhaustion, inflammation, or unexplained health challenges. And tell me in the comments, have you ever been informed you might have an autoimmune condition, or has it consistently been dismissed as normal aging? I read every comment, and I'm genuinely curious how frequently this gets missed or overlooked. Now let's address Group AB. Group AB is the most recent blood type in human evolutionary history. It emerged relatively recently when populations carrying Group A and Group B antigens began interbreeding at scale. And because of that dual genetic inheritance, it possesses a genuinely distinctive immunological profile. On one hand, Group AB inherited immune tolerance characteristics from both parent types. AB individuals demonstrate reduced inflammatory responses to certain environmental antigens, which translates into meaningfully diminished risk of some gastrointestinal malignancies and specific gastric pathologies compared to other blood groups. But here's where I need your undivided attention, because what Group AB gained in immune tolerance, it paid for in neurological susceptibility, and the research has rendered this increasingly impossible to disregard. Group AB individuals carry a statistically elevated risk of cognitive deterioration, including vascular dementia, compared to Group O individuals. The mechanism is cerebrovascular. Group AB blood carries elevated coagulation factors inherited from its A component, combined with the cardiovascular intricacy of the AB antigen profile. Over decades, this generates subtle but cumulative alterations in blood flow through the brain's smallest capillaries, the microvessels that service the regions most critical for memory consolidation, processing velocity, and executive function. These aren't overt blockages. They're microscopic, progressive reductions in perfusion efficiency across neural tissue that most individuals wouldn't detect until the cumulative impact has been accumulating for 15 or 20 years. This is precisely why, for Group AB individuals, cardiovascular health and cognitive health are not two distinct conversations. They're identical. Blood pressure regulation, blood glucose stabilization, cholesterol and triglyceride surveillance. Every intervention that safeguards your arterial health is simultaneously safeguarding your cognitive longevity. DHA, the long-chain omega-3 fatty acid present in fatty fish like salmon, sardines, and mackerel, integrates directly into neuronal cell membranes. It preserves membrane fluidity and attenuates the neuroinflammatory signaling that accelerates small vessel pathology. 2 servings of fatty fish weekly, or a pharmaceutical-grade fish oil supplement discussed with your physician, is not elective supplementation for Group AB individuals. It's targeted neuroprotection grounded in your specific biology. Sleep is the other absolute requirement. During deep sleep, your brain's glymphatic system, its internal waste elimination network, removes accumulated metabolic debris, including the amyloid proteins linked with neurodegeneration. Consistently sleeping under 6 hours substantially impairs this mechanism. For Group AB individuals, chronic sleep deprivation isn't merely exhaustion. It's accelerating the precise biological process your blood type already renders you more susceptible to. 7 to 8 hours nightly. This is your most powerful daily intervention. Group AB. Remarkable immune tolerance. A brain that demands deliberate, consistent, long-term protection starting immediately, not at 70. If you're still with me and this is resonating so far, just type "it helped" in the comments. I genuinely read them, and it helps me understand what's connecting with you. Now, before we conclude, there's one more variable almost nobody incorporates in these conversations, and it's significant. That plus or minus symbol at the end of your blood group designation. Rh positive or Rh negative. Approximately 85% of individuals are Rh positive, meaning they carry the Rh antigen on their red blood cell surface. The remaining 15% are Rh negative, and this distinction is not cosmetically insignificant. Rh negative individuals appear to possess a modestly distinct cytokine signaling profile, meaning the chemical language your immune system employs to communicate is calibrated differently. Research is still determining the complete clinical significance of this, but what's emerging suggests that Rh negative individuals may demonstrate heightened sensitivity to specific inflammatory triggers. Which means, irrespective of your primary blood group letter, if you're Rh negative and managing any chronic inflammatory condition, the anti-inflammatory protocols I've outlined today are even more applicable and should be implemented more rigorously. For women who are Rh negative, if you're pregnant or considering pregnancy and your partner or baby may be Rh positive, this is a medically essential conversation to initiate with your obstetrician immediately. Rh incompatibility during pregnancy is entirely manageable with appropriate medical intervention. It necessitates that intervention, and it necessitates it proactively. Know your complete blood type, the letter and the symbol. Ensure your physician has both documented. Now here's the most critical thing I'm going to communicate today, and it's the element most blood type content entirely sidesteps. The statistics are authentic, the risk elevations are substantiated, the biological mechanisms are genuinely consequential, and they are absolutely not your fate. I've witnessed Group AB patients in their mid-70s with more acute cognitive function than peers 15 years younger. Not because their genetic risk profile was somehow altered, but because they comprehended what their biology was contending against, and they constructed their daily existence around addressing it. They slept 8 hours. They consumed 2 servings of fatty fish weekly. They sustained their blood pressure below 120/80 consistently, not sporadically when convenient. They continued learning genuinely novel and demanding material, not passive scrolling, but authentic cognitive engagement. Their risk remained present. The statistical profile still pertained to them. They simply elected to confront it directly rather than permit it to accumulate silently in the background. The distance between genetic predisposition and actual health trajectory is not minimal, it's vast, and it's occupied entirely by choices executed consistently over years. That distance is where your agency resides. Your blood type is not a verdict. It's a roadmap, and a roadmap is only valuable if you're prepared to examine it. Now tell me something. What's your blood type? And does the profile I described today align with what you've actually been experiencing in your own health over recent years? Drop it in the comments. I read every single one, and what surfaces consistently in this community informs the topics I address next. If you found this useful, there's another video linked in the description where I walk through the 3 most commonly overlooked root causes of persistent exhaustion and elevated blood pressure in men and women past 55. Conditions that are addressable when identified early and almost invariably mismanaged when they're not. Take excellent care of yourself. You've carried this body a long time. It deserves understanding exactly how it functions.